a way to cast off zits, scars and darkish marks. Similar to the lingering emotions you revel in after an excessive recreation of Thrones episode, acne scars are essentially the enduring after effects of your quick-lived breakouts. And sudden pimple, or 5, is stressful enough, but the pimples, scars and darkish marks it leaves at the back of are regularly worse. While there is not a magic wand that could put off them in a single day, pinnacle dermatologists from throughout the United States of America proportion the way to cope with marks and bumps, from prevention to remedy. What's the difference between pimples, marks and zits, scars? That allows you to deal with zits, marks and scars. It's beneficial to learn how to distinguish between the two. Patients often mistake dark spots for acne scars, however they are truly very exclusive, says Big Apple-based totally dermatologist Whitney Bowe, MD. The crimson, pink, or brown marks that linger after a pimple or blemish has disappeared are categorized by derms as post-inflammatory hyperpigmentation. Those marks can take between 3–6 months to go away on their personal, notes Sejal Shah, MD, a New York primarily based dermatologist. You could expedite the procedure with a diligent treatment of topical retinoids, nutrition C serums, sunscreen, and over-the-counter brighteners. True acne scars, but, are permanent indentations from collagen damage and might are available in many shapes and paperwork, says a Dr. Bowe, and laser treatments and transient dermal fillers are the handiest methods to deal with the difficulty. Some scars are thick, raised hypertrophic scars that stick out above the skin, others are keloid, which can be scars that have overhealed, and occur as dense, rubbery pores and skin tissue. Then, there are atrophic scars that seem as depressions within the skin. They may be the most tough to deal with. The 3 most important classes of atrophic scars are: ice pick scars. Deeper than they are wide, with jagged edges. On occasion they resemble a huge, scooped out pore. Boxcar scars. Large, rectangular depressions with steep, defined edges. Rolling scars. Wide depressions that have rounded, sloping edges, subsequently the name. What causes pimples, scars and darkish marks? The spots that linger after a pimple has healed are due to irritation that has disrupted the pores and skin's herbal healing system. Whilst your skin is spread out, like whilst you pop a pimple, after which closes lower back collectively, you can get strange pigmentation, texture, and tone that appears distinctive from the rest of your pores and skin. Every now and then the broken blood vessels that remain after an acne lesion fades can result in a mark, says a Dr. Bowe. For some of people who are able to course from selecting, inflamed zits or blemishes can nonetheless go away a darkish brown or red mark, however those clearly fade over the path of some months, notes Heather C. Woolery-Lloyd MD, a Miami-based dermatologist. The tone of your pores and skin makes massive difference within the coloration of the spot. In lighter pores and skin tones, crimson or red marks are extra not unusual and fade over some weeks. For darker pores and skin tones, a pimple typically leaves a brown mark that takes uncommon 4 months to head away on its very own, says a Dr. Woolery-Lloyd, who founded Unique Beauty, a skincare line mainly designed to treat choppy pores and skin tones, hyperpigmentation, and different problems that women of color have a tendency to face. When you consider that it is quite hard to decide what reasons one character to scar greater than every other, the great way to keep away from scarring is to treat zits with amazing pores and skincare recurring, and which means you want to face up to selecting, poking, or touching a pimple. But, from time to time a mainly competitive blemish is genuinely on a challenge to depart its everlasting mark. Pimples, scars occur whilst regular tissue in the pores and skin is destroyed and changed with fibrous tissue. You could think about an zits lesion as a wound. While the damage as a result of pimples is extreme, the frame can respond by creating an excessive amount of tissue or too little tissue. The production of too much tissue paper work a keloid or a hypertrophic scar, and too little tissue leads to that despair within the skin, or atrophic scar. The deeper and greater infected the zits lesion, or the extra that it is picked or squeezed, the more likely it's far to scar, says a Dr. Bowe. Some zits marks and scars are completely inside your control whilst others are pre-decided. Apart from genetics, there are numerous lifestyle habits that may make dark marks and scars worse. Solar exposure can supercharge melanocytes, or pigment-producing cells, inflicting marks and scars to darken. And, to reiterate one last time, selecting or squeezing zits creates similarly irritation and can ultimately cause more damage, Dr. Woolery-Lloyd and Dr. Bowe both warn. Right, here's the full rundown on how to take away pimples, marks and scars. A way to treat pimples, dark marks. The discoloration from dark marks will normally fade through the years, says a Dr. Shah. But there are some of treatment alternatives to help speed up the manner. Sunscreen. Solar exposure makes scarring appear greater prominent, says a Dr. Shah. While your skin isn't always properly included, UVA and UVB rays can darken zits marks and scars. Daylight may even penetrate through your apparel, so it's critical to be diligent approximately applying it everywhere, every day. And don't worry approximately breaking out from a pore clogging sunscreen. The contemporary formulation are greater, innovative and acne friendly than ever. Ulta MD UV Clean Wide Spectrum SPF 46 is a top derm authorized favorite. It consists of niacinamide, that is an anti-inflammatory that facilitates reduced redness. Topical Diet C Serum. Vitamin C can assist construct collagen and promote restoration, says a Dr. Shah. SkinCeuticals CE Ferulic Serum is a mixture of natural L-ascorbic acid, which is nutrition C and absorbs into the pores and skin so that it continues working even lengthy after it dries. Retinoids. Retin-A is a superficial treatment that allows with pimples marks by inflicting your pores and skin cells to divide more hastily and pushing out cells with discolored pigment, Dr. Shah explains. Considering that retinoids make your pores and skin terrific touchy to the sun, it is best to no longer handiest wear SPF, however to also practice a treatment like rock retinol correction sensitive night cream earlier than you visit mattress. Chemical peels. A chemical peel is a remedy that makes use of the utility of slight solutions for skin refinement and regeneration. Products containing glycolic acid promote mobile turnover, which is the process in which new pores and skin cells form and assist even out your skin tone, says a Dr. Bowe. You can attempt an at-domestic peel like Peter Thomas Roth 40% triple acid peel, which makes use of both glycolic and salicylic acids to help fade spots by using exfoliating dead pores and skin cells and smoothing out pores and skin texture. Or, your dermatologist can prescribe you a more potent peel based to your skin kind and treatment desires, says a Dr. Bowe. Skin brighteners. For marks which are more brownish in color, pigment lightening substances like retinol, vitamin C, kojic acid, or licorice can help treat discoloration. When you have a deeper skin tone, be wary of formulation with hydroquinone, which Dr. Woolery-Lloyd says can leave a lighter ring across the dark discoloration you're trying to goal. Rather, strive L'Oreal Paris Adolescence Code Darkish Spot Correcting and Illuminating Serum Corrector, which allows to reverse hyperpigmentation and save you in addition discoloration, or Precise Beauty Intensive Skin Brightening Serum, which incorporates an effective blend of the exceptional brighteners, consisting of retinol, licorice, and niacinamide, and component that can also help alleviate zits. Pores and skin brightening components do not work as nicely for crimson or pink zits marks unrelated to the skin's pigment or melanin. Those have to be dealt with sun safety and may be lightened extensively. The usage of a laser known as a pulsed dye laser that objectives hemoglobin, red pigment. It normally takes 3 treatments to make them depart completely, however they are able to loosen up appreciably after just 1 treatment, says a Dr. Bowe. In case you're no longer seeing development within 3 months from the usage of over-the-counter remedies, it is probably time to see your derm to see if a more potent topical prescription or laser remedy is an alternative, says a Dr. Shah. How to treat pimples scars. Pimples scar treatments are first-rate, treated with special attention and care out of your dermatologist, considering they require greater excessive techniques than over-the-counter alternatives. The downside, treatments tend to be costly. In case you aren't quite equipped to place a dent for your savings, know which you aren't by myself in your warfare with pimples scars. Simply with the aid of reframing your way of thinking, you could even learn to love them. Steroid injections. In case you sense a strained pimple rearing its ugly head, a steroid shot can be administered the equal day you name your derm, due to the fact the method could be very rapid. No longer best does it immediately reduce the irritation of unpresent zit, but cortisone also can assist thick scars, keloids, appear softer and flatter. Those are specially for raised scars, but, says a Dr. Shah, it's going to assist flatten out the scar, however it might not do anything to any discrepancies in the feel. Dermal fillers. Certain scars may be packed with a substance that elevates the depressed regions, like hyaluronic acid. This will make the floor of the skin more even and cast off shadows, says a Dr. Bowe. Until these days, fillers weren't a lasting answer. But now, in case you're over 21 years vintage, Bowe is the first FDA-authorized dermal filler designed for completely correcting mild to significantly dented acne scars. Not like different fillers, it includes 2 specific elements to assist enhance pimples scarring. It is 20% polymethylmethacrylate, BMA, which allows your frame make more protein to allow itself to heal, says a Dr. Shah. BMA are tiny balls that type of act as a scaffolding. Maximum fillers degrade over the years, however, due to the fact BMA can't be absorbed into the body, this gives a permanent result, she says. The alternative 80% is collagen. The procedure takes about 20 half-hour, and while you can want a touch-up a pair months later, a few humans simply want the unmarried remedy, says a Dr. Shah. There are also transient options that follow like makeup and are easily detachable. Dermaflage makes an amazing one. Lasers. Dermatologists regularly redesign collagen. The usage of lasers, which do no longer absolutely put off zits scars, however can enhance them via 30% or greater, according to Dr. Woolery Lloyd. These can be beneficial in decreasing the redness associated with acne marks and scars. I take advantage of a pulsed-eye laser known as the V-beam for crimson scars. When treating older scars that are not pink, I love to apply the Fraxel laser. When lasers are used to deal with zits scars, the outcomes can vary dramatically based on things, how many remedies you have got performed, and what sort of social downtime you are inclined to just accept as part of the healing process, says a Dr. Bowe. Erbium laser resurfacing is also any other alternative, and it's more aggressive than Fraxel, says a Dr. Shah. It is a minimum burning of surrounding tissues and has fewer aspect effects like less swelling and redness, but it's won't paintings for those with darker pores and skin tones. Punch excisions. This process is satisfactory for those with ice pick scars, which are not as wide as rolling or boxcar scars, says a Dr. Shah. If you use a punch excision on a scar, it's huge at the floor. You are making a larger punch in buying and selling in a single scar for another, she says. Your dermatologist will numb up the vicinity and use a tiny cookie cutter-like device to reduce out the scar, after which stitch it closed with a tiny stitch. The sore is eliminated in less than per week, says a Dr. Bowe. Mix and healthy. Seeing that acne scars range, so do treatments. Relying at the person, I often use a multimodal technique to treating pimples scars. First, I would use fraxel remedies to easy out the pores and skin texture. Then, I frequently use a mixture of the fillers Restylane and Bilatero to raise the depressed scars. Subsequently, I carry out a few punch excisions to surgically do away with any deep scars that could continue to be, says a Dr. Bowe. There you have got it. As with any pores and skin situation, it's high quality to consult your everyday dermatologist to see which option is first rate for you. And while technology has come an extended way in making darkish marks and zits scars treatable, understand that maximum people will revel in them in some unspecified time in the future. So whilst these are all feasible alternatives for fading your acne scars, bear in mind which you continually have the choice of pimple positivity, too.